Okay, so let's talk about ears and otoplasty. What's otoplasty? Otoplasty refers to a procedure where we can reshape the ears. And this is a problem of all ages. I see infants who have ear deformities, and I see adults who have been living with an ear deformity their whole life and they're finally ready to do something about it. The most common reason that people will complain about their ears is they're too prominent. They stick out from their face or their head too much. And we can do a procedure called otoplasty to correct that. The typical patient is probably around 5 or 6 years old and has some prominent ears, and we might do about an hour and a half outpatient surgery to get those ears in a better position so they're not teased in school. Some people didn't have the opportunity to do that when they were kids, and they do this later as adults, and it actually can be done in the office under local anesthesia. There's a few neat procedures that I do that I think are a little bit different. One is I can do something called an incisionless otoplasty. So typically an otoplasty does have a scar behind the ear, and there are some people, when they meet the right criteria, we can reshape the ear with no incisions at all, and that works great. So it's kind of a hidden procedure. The other procedure that I do that requires no surgery is in newborn infants. We'll have some patients whose parents and pediatrician recognize at a very early age that there's a prominence to the ear or an ear deformity. And we can do some things in the office to reshape, remold the ear without any surgery so that they don't need that future otoplasty. So it works out great. We have a lot of before and after pictures of the patients who have had this procedure. You know, we have some examples of some young kids who have had it done. We have adults who've had it done, more kids, and we have lots of infants who have had what's called our ear molding procedure called the ear well. And come in to face us first and we can tell you all about it.